Hi, I'm Dr. David Jankowski with Summit Physicians Group. I have Dr. Jeffrey Wingate, board certified spine surgeon, and we're going to talk about complex regional pain syndrome. Dr. Wingate, what is your approach to this patient? They've gone to various surgeons, they've had procedures done. What's the solution?
Well, it is a multidisciplinary approach. Okay, this is not a patient who, for the most part, will have one doctor who can fix everything. This is ultimately the patient who may benefit from you as an anesthesiologist with special certification in pain management. They can benefit perhaps from revision surgical techniques that I've used for more than 2 decades. These are some of the most interesting patients as far as I'm concerned. In general, we have to start out with imaging. We can learn a lot from plain x-rays. We can learn a lot from an MRI scan that will show us the soft tissue structures of the spine. And for a lot of these patients who've had surgical procedures, something as simple as a CT scan. A CT scan will be a 3-dimensional x-ray test where we can now see hardware or bone grafts that were placed into the spine. And ultimately what we're doing is we're preparing an inventory. We're preparing a bucket list of what works, what doesn't work, what has continued to provide stability and what has failed to provide stability. And it's when we put all of those factors together that we can seemingly come to an understanding of why these patients are so miserable.
Is there ever a solution in this situation? Does it ever end?
I look at it from the opposite approach. From my perspective, there's almost never a solution. There's almost never a lack of solution, to paraphrase. The patients who come to us with these problems, some of them will have an underlying nerve problem, and we may need to do some medical workup. We may need to do some type of diagnostic test to prove that we can get that nerve to calm down. If we can't get the nerve to calm down, perhaps we need to unpinch the nerve, perhaps we need to stabilize the environment around the nerve, or frankly, if the nerve is damaged, sometimes we need to confuse the nerve. We need to use an electrical, a low output electrical device called a stimulator that can modulate the pain activity that the brain receives.
How successful is this treatment?
I think these treatments are very successful. This is a group of patients that have been ostracized from medical treatment for decades and decades. Many of these patients come to us, they have very low functional scores on a day-to-day basis. Many of these patients will have 1 or 2 good hours of the day where they can get some things done, and the rest of the time they're taking a pain pill, they're lying down, they're using a whirlpool or a hot tub massage, something that can help them gain some control over their pain, and it can get them through the rest of the day. These are the patients who rarely cannot be helped. These patients come to us with a tremendous amount of frustration. They come to us with oftentimes psychological overlay, depression, anxiety about their pain. And really and truly, to serve them justice, we have to come to grips with all of those different components in order to put together a program that can really help them.